So, first of all, I'm honored to be here with my colleague Aman Iskandarani in this research and also to in front of you. So, I'm Dr. Falak Hassan Sbira in the Faculty of Media in Damascus University.
تمثيل مرضى فيروس كورونا في وسائل الإعلام وعلاقته بالوصمة الاجتماعية والصحة النفسية. طبعا هدف البحث إلى التعرف على طبيعة العلاقة بين تمثيل وسائل الإعلام لمرضى فيروس كورونا وربطه مع متغيرين أساسيين الصحة النفسية ووصمة العار لدى
stigma and to the mental health. So because in Damascus, we have seen a lot of stigma and mental health related to the representations in coronavirus patients. And this is, of course, based on the gender, the age, and the social situation. And for the sample is to identify the relationship between the representation of media for coronavirus patients in mental health and also stigma in a sample of individuals in Damascus. And also this study was to find out the differences and the discrepancies between 200 infected people and 200 people who are not infected with coronavirus. And also, we have used many measures and many scales in order to find out the levels of and the results of this study, which I will let my colleague Amal Iskandarani to give you the findings. So, hello everybody. So, my name is Dr. Amal Iskandarani, and for the findings of our research, we find out that there is a real relationship and a strong relationship between the social stigma and also all the source adopted by the individual to find out the information related to the coronavirus and also the patients of coronavirus and the days in which the coronavirus patient will be hospitalized, and also there is a strong negative relationship between the mental health and all the sources that the individual will look for information from which related to the coronavirus. And also there is a strong negative relationship between the social stigma and also the mental health, as when there is an increase in the social stigma, there will be, of course, a decrease in the mental health. And also, we find out that females are always looking for many sources regarding that males. So females are looking as many sources as the males do. Also, like for example, for the females they are trying to find the information from the social media like Facebook, Twitter, Google, YouTube, and also from the classical media like the TV and the newspaper and so on and so forth, and the electronic sites. But for the males, they used, of course, social media like Facebook, Twitter, Google, YouTube, and also some electronic sites. And also in relation to the gender difference. So let's move now to the relation or the difference in age group. So we categorized the age groups from 80 to 29, from 30 to 44, and from 45 to 60, and from 60 to more than 60. According to our study, for the representation of coronavirus patient in media, we find out that the people between 45 and 64, they are the most age group to look for various sources in order to get information about coronavirus patients and coronavirus in general. And also, most of them have used in priority Facebook and Twitter as social media. But for the people who are 65 or more, they just use the newspapers and the TV channels or the radios. And for the age group from 18 to 29, they just use the social media. They did not use the classical media like TV and radio and so on, or the newspapers. And the age group who has longer time looking for the information related to the coronavirus are from 45 to 64, and most of them they are from females, not from males. And also for the marital status now, let's go through the differences between the marital status or the familial status if is or she is single or divorced or widowed. So there are no difference regarding the marital status or the social status or the familial status in relation to what are the sources adopted by those people. And also there are no differences between males and females in the social stigma, and also in relation to the married people. The married people are mainly they are the married people who look into various sources.
الأرامل. أما فيما يتعلق بمتغير الإصابة أو عدم الإصابة بالفيروس، في متغيرات بحثنا. نبدأ بمتغير الوصمة الاجتماعية، فقد كان هنالك فروق بين المصابين وعدم المصابين. في الوصمة الاجتماعية صالح الأفراد المصابين بفيروس كورونا.
Stigma between the infected people and the uninfected people, because the infected people they are the most people to have social stigma, and also we try to measure whether there are discrepancies or differences in the representation of coronavirus patient in the media, but we did not found any high difference except for the days that the individual would use the media in order to follow the news related to the coronavirus. And also people who are not infected, they are less interested to look into the sources that provide the news about the coronavirus, and also the days of hospitalization or the days of sickness for the infected one.
أشكرك دكتور سلوى على إدارة الجلسة. أشكرك على إدارة الجلسة وأشكر
Thank you, Mr. the Chair, and also would like to thank the Areacore for that, and also I would like to say hello to all the participants, all the panel speakers, and all of you. And I think that all the presentations were very rich, and I hope that I will be also concise to summarize my study and also to respect the time as much as I can. As you mentioned, Dr. Salwa, so my study is about the stereotypes in COVID coverage in the Egyptian press. And I will speak about four main. So the first one, introduction, then the importance of the study, then the aims of the study, then the methodology of the study, and also the conceptual framework of the study, and then what are the results of the study. So first of all, let's say that there are many media studies that have been conducted lately in Egypt and also had found out a lot of indicators about the discriminatory view for those who had been infected by the COVID-19, and also they are trying to propagate some of the misinformation related to the conspiracy theory. And also from this point of view, I tried to observe what are the stereotypes of the coronavirus patients that had been used by Egyptian press. The importance of this study is that this study is dedicated to be like a warning for the decision makers and media institutions that they have to improve all the principles that regulate the press and media coverage in this kind of crisis. And also, why the study is so important is because it will provide a critical view for how the media and the press in Egypt will deal with the coronavirus patient. And also, the main objective is to analyze, to monitor, and to describe how the Egyptian media and press has dealt with such stereotypes. For the methodology, first of all, the type of the study. So this study is belonging to the analytical studies, and for the sample of the study, we had used 3 electronic sites or 3 websites, 3 press websites from Ahram, the pyramids, and Al-Wafd, and Al-Masri al-Yawm, or the Egyptian Today newspaper. The conceptual framework of this study has been taken from the stereotype concept, which is drafted by the American Walter Lippmann for the first time in order to express its psychological meaning in 1922, and also the stereotype is the meaning of all the psychological impressions that are formed or that are created against some of the individuals or some of the groups. And also the stereotype in a historical point of view was demeaning and also humiliating these individuals or these group of individuals. And for me, for the findings, of this study, we used the content analysis tool in the quantitative and the qualitative, quantitative and qualitative content analysis tool, and analyzed 97 press releases or press articles, distributed in those 3 websites. And also I will give you the findings. Also, first of all, it's the analysis of the form, which is related to the images, for example, that are used, and also the diverse means that are used for the coronavirus patients. And so the forms or the press forms that had been analyzed, running too fast as usual, sorry. So this is the table will provide you what are the press forms that use the press forms that are used in the sample.
Dear
so
Sohair,
here we have 13
can you just slow down a bit for the translation? Thank you.
So for the news, we have 13 pieces of news from the pyramids, 37 from Al-Wafd, 22 from Al-Masri Al-Yawm, and also some of them are explanations related to those pieces of news, and the use of the filmed storytellings, and also for me, I think that on the internet it is
النوعية من المواد الإلكترونية كان نادرا 4 مواد صحفية من 97 مادة لا يمثل أي نسبة.
So that when we use 3 or 4 sources to work on in this study from 97 websites, or so this is not too much, you know. And
and that, of course, entails a level of superficiality in dealing with the, of course, the piece of news. So I believe that there should have been more effort paid on the part of the 3 sites in dealing with this matter. Now, with regard to the second course, which is the qualitative analysis in the study, so I was able to extract 6 main images, 5 of which represent pejorative or negative images. The idea that a COVID patient is dangerous, needs to be pitied. The case is described, of course, in exaggeration. They usually are stigmatized as sick and they should be kept away, and stigmatized as weak and a victim of others. There's only one positive image, which is that the patient of COVID is a strong person. Now, let me here give you an example, of course, to give you clear pictures. For example, talk about the first picture, saying that a COVID patient is a dangerous person. So here in the 3 websites, or in the 3 sites, we see this image, of course, over and over again, especially in the website. And you will see here on the website, or in the table, that there's 20 pieces in Al-Wafd newspaper, where or a website where we see the description of COVID patients as dangerous, and here this was clarified by describing that when you talk about danger, that patients could be danger to themselves, and talking also about patients who have also other diseases that could be exacerbated by COVID-19. Also, we have seen exaggeration is Al-Wafd portal in publishing scientific studies with the American or European, pointing the dangerousness of COVID patients who already have cardiovascular diseases or cancer or kidney disease. And that they have used such phrases are more have priority, more difficult, less more dangerous, and so on and so far. So they have used different verbs such as be careful, so increases the chance of infection and reduces the opportunity for survival. So such expressions, of course, show the extent to which or they describe the patient as dangerous. Also, an Ahram platform, electronic platform, showed how dangerous COVID patients and the danger of COVID patients pose to others. And this created, of course, a state of fear and chaos sometimes as well. So, for example, in one of report or an article, it says about COVID. Fear definitely has a place inside this. So here the writer talked about the fear, of course, that is associated with COVID. And in this article, there were some very there were many colloquial expressions used to express how dangerous COVID is and how dangerous COVID patients are, and that, of course, stressed this topic. As to Al-Masri website, they actually talked about bad habits that increase the danger that COVID patient poses to themselves and to others. And here in this news, they gave international examples, not just examples from Egypt. They talked about India and about giving an example about a doctor in India, talked about the health situation there. And they talked also about they used also some expressions where they stressed a negative, of course, stereotype of COVID patients. So this was the first image. The second image is that of pity. So COVID patients need to be pitied. And here we have seen this. We've seen the COVID patients described as people who need people to feel bad for them and to be pitiful for them. And I was not happy at all working on this part, because here we have seen the use of expressions and words reflecting this image about support, talking about the difficulties, talking about charity to help the poor and the COVID patients to help them through the crisis. It's the image of COVID patient as someone who needs to be pitied, that we need to show them compassion. And there was this very bad presentation of COVID patients. The same image we have seen in the Masri website, but from a different perspective, because here there was a focus to actually show that the government is doing its job in dealing with this crisis. So it's a matter of fact, but we have noticed that there's a tendency to exaggerate that. So, for instance, saying that there is a representative of the ministry in one of the areas distributing, of course, candies to COVID patients, or they can group pictures with COVID patients, or so. Such descriptions show lack of interest in this matter, and it is just looking on just the superficial things, or showing the government as doing some extra effort in this regard. Also, we noticed the use of some more expressions that to target the feelings of readers. For example, officials are trying to provide psychological support to COVID patients and between parentheses, in an atmosphere of kindness and happiness and love. So as to the part of the news piece about the representative of the media, there was a picture on the newspaper website saying that COVID patients taking a good picture with their representative. So it's just let's say that it's just even funny. You could say that it's laughable, talking about COVID patients and taking pictures, because that shows this idea of that of course if this official takes pictures with them, that is some sort of a psychological support. And we have seen this news of course in detail, discussed in details. Also, we have seen expressions, of course, showing the, of course, expression. This is describing this as a humanitarian gesture, and this representative represented as known for his humanitarian action and a good spirit, and so on and so forth. Now, as to the third representation, where they focused on exaggeration of the case of COVID patients' cases. So here we're talking about painting a larger picture, exaggeration, spreading fear, and we have seen in abundance in Al-Wafd portal where they exaggerated in publishing a number of scientific studies from different, of course, countries, and these studies included just information that spread fear about COVID-19, about the patients, and that their lives are in danger. And for example, they shared in news, for instance, by WHO, that most COVID patients will not be able to develop antibodies, despite the fact that they were, of course, diagnosed with the COVID. And this news was not supported with any scientific details or information. It's just an opinion of an official, and we do make this mistake recurrently. So quoting opinions with of officials as if they are a matter of fact, without any proof, without any scientific backing. And so it's very important that in such times to actually be able to check the veracity of news, to make sure that such quotes either are backed by scientific studies or not challenged, so that we do not consider it as misinformation. Also, we have seen on the left portal the use of such expressions and words that exaggerate the cases of COVID-19. For example, the COVID patients are more inclined to develop this or that symptom, or to be in this or that danger. So we have seen many headlines that create fear and chaos around the patient of COVID. As to the fourth picture, it's very common, and it's an image of stigmatization of the COVID patients, and starting to keep a distance from them. When you have seen in Al-Ahram and Al-Masri today portals where they have mentioned, they have published many reports about, of course, the fact that social stigmatization about social stigmatization of COVID patients, and they talked about, for example, the fact that some of the villages people refuse to bury one of their people who was infected by COVID. So this happened, and it was very sad, and it was discussed by all news and social media. And unfortunately, this topic was addressed in a negative way. There was also there were many similar incidents. For instance, there was a news piece on one lady who refused to help her sister once she knew that she was diagnosed of COVID-19, and they used a colloquial phrase saying, "I can first," or "my health can first," or so, and showing that this disease could stand even between humanitarian relations and brotherly, sisterly relations. Also, the website published a news piece about COVID patients, and the fact that they also have some, due to this COVID, they have also suffered from other psychological issues. Or this is also the fifth now image is showing COVID patients as weak, as victims for others. So this image was present in both of the portals, of both three portals or websites, where we have seen especially the topic of where they address the topic of private hospitals and clinics dealing with COVID patients as a commodity, and talking about that private hospitals asking COVID patients to pay 400,000 pound, of course, upfront, and that these hospitals are trying to benefit from the pandemic. And the fact that patients now need to know someone in certain hospitals so that to be able to secure a spot and to secure an opportunity for treatment. So unfortunately, this is what we have seen in describing the COVID patients as victims. In another image, we have seen another image in a Masr al-Yawm website when they published a whole story about one of the nurses actually sexually harassing a female COVID patient. And they quoted the patient saying that the nurse did not show any mercy because she was sick, and that they actually sexually harassed her and molested her. As to so these were the 5 negative stereotypes. Now this is the 6th image, and I know that I might have run for too long, but this is the last point. So the 6th point was rather positive, or it was actually positive, and here they showed, of course, some positive aspects of people who healed the COVID, and they showed them as strong people. So these people are now stronger and physically stronger, as that they have developed antibodies that could be also used in treating diseases and plasma. And now we have a national campaign that encourages, of course, people who recovered from COVID to donate plasma. And now there's this image that COVID survivors now are stronger physically, and that they can donate, of course, the plasma to help science, to help other people. And we have seen many officials encouraging citizens to donate plasma, or we have seen them also publishing stories about some citizens who donated, of course. So here we have seen good stories or positive stories, and this is the one and only positive representation of COVID patients. Compared to the 5 other representations or pictures or images of COVID patients. Thank you very much. Thank you for your attention during this presentation. I'd like to thank Dr. Salwa for, of course, sharing this session. Thank you. Introduction, and I'd like to thank one more time, of course, IPSI, and I would like to thank all the partners for this opportunity to participate in this international seminar, of course, on stereotypical reporting in a pandemic. So as you have mentioned, my presentation on social stigma in the pandemic, we're talking about the roles and ethics. So as an introduction to this research, I will try by presenting some of the facts that we have presented previously, talking about COVID is a new, of course, a pandemic, and the fact that we did not have enough information about it, about the disease, and the lack of access to such information increased, of course, rumors and suppositions, and this created a state of chaos and fear and worry amongst people. And of course, the more we saw the state increases, the more others, practices were blamed for spreading the virus and the pandemic, and foreigners also were blamed, or Tunisians who living abroad who came back to their country were also blamed. So we have seen an increase in stigmatization. So this, of course, this stigmatization that we have seen during the pandemic was described by Philip Strong since the 80s of the last century. Of course, in the framework of what was described as pandemic social studies, and where they discussed at the time, they talked about the pandemic resulting from HIV virus is related to the dynamics and the social system. And so they noticed that during such pandemics, there is an increased fear of the other and spread of stigmatization of the others, accusing others of the reason of spreading the spread of this pandemic. And so here we consider media not as just an actor that publishes news, but as if someone who plays a role in this fight, the fight to spread correct information, to clarify, of course, and to fight disinformation and misinformation about the pandemic. And we have, of course, a professional responsibility and ethic and social responsibility that requires that we stop all sorts of social stigmatization. So the question is how media and the social and the media actors in Tunisia were able or managed or tried to actually stop or work against social stigmatization of COVID patients or some certain categories associated with COVID. So we talk about the samples of this research. The sample of this research were taken from four, of course, news websites, and they are amongst the most, of course, popular and the most followed, of course, electronic news, according to e-business consulting and training. These these websites are, of course, Business News, Al Maghrib newspaper website, Mosaic FM website, and TV1 Tunisia website or national TV website. So these are amongst the websites that are most trending, most followed by people. As to the time frame of this study, they covered 2 months, March and April 2020, where we started the start of the pandemic spread in Tunisia, and there was, of course, the reaction at all levels to the pandemic, including media. We added also July 2020, of course, which came after the decision of the presidency of the government of Tunisia to open, of course, borders for foreigners to come into Tunisia. And the idea here is to identify or to study how did the media cover these events and whether they, of course, take into consideration their social responsibilities. Now, this research included all the articles published during the time frame of the research, and we have 237 articles, and these are the articles that covered the events, and it included, of course, social stigmatization of certain categories, whether patient or returnee Tunisians from other countries or foreigners. So, as we said, we took our articles from 4 websites. First website, Business News, we took from this website 76 article. As to Al Maghrib newspaper, we took from their website 12 articles, and then 101 article from Mosaic FM website. As to analysis methodology, we used the qualitative and quantitative analysis. So we did content analysis, and we worked also on interviews with journalists that cover these events to study how aware they are of their role. So we focused on the theory of stigmatization, which focuses generally on, of course, the process by which people are classified or stigmatized, and how society develops a negative or pejorative reaction to these people. Also, we focused on of course, on the concept of Philip Strong in his book, Sociology of Health and Illness, where he describes pandemics as and the challenge for the public order and society as, of course, they require individual response and moving stepping away from the group. And talking about where he also talked about the pandemic of panic, social panic and fear, which of course might turn into a pandemic of stigmatization. Also, we focused about the, of course, ethics of the job and the responsibility, ethical professional responsibility. We also focused on the manual to counter social stigmatization prepared by WHO and UNICEF and the Red Cross. So this manual, as we said, was prepared in partnership between these organizations. And this manual targets governments and the media institutions and local organizations working on COVID-19. And this manual described in detail how to counter social stigmatization, whether linguistically or at the level of behavior. And the manual considers the terminology and the expressions used on social on the media channels in general, specifically important as they will form the language used by the people when talking about the virus and the pandemic. And that could lead to, of course, feeding into the fear and chaos, and that might lead actually to looking at infected people as non-humans, or to forget the humanitarian aspect when dealing with them. Also, of course, the manual says that the governments and citizens and main influencers and actors play a very important role at the level of behavior in stopping the social stigmatization. After qualitative and quantitative analysis of the articles, of course, and the samples collected for the analysis, we were able to get these findings. So we, as we said, we relied on the manual prepared by WHO that we have pointed earlier. And they mentioned such expressions and words that should not be used. So expressions such as COVID cases, victims, incoming cases, suspects cases, such expressions, of course, are discouraged from use because they describe people as cases. Also, other expressions such as spreading the virus, spreading the infection, infecting others. Also, such expressions were discouraged from being used. Because these are expressions, and this is a language that could result in feeding the fear and panic. Also, we have seen many, at more than 2/3 of the articles, of course, used these expressions. So they used victims, they used COVID cases. So we have noticed also the use of expressions such as spreading the virus, spreading the infection, infecting others. We have seen that these expressions were raised. Also, we have seen that in these articles, they used exaggeration, talking about a situation of uncertainty, of chaos, of fear, anxiousness. We have seen that such expressions used over and over in many of the articles that we studied, and also we have the expressions, of course, saying that, for example, people not respecting quarantine and other expressions for COVID patients, of course, that are rather pejorative. We have noticed that there is, we know that such cases, yes, that existed, but there's an extra focus by media on such cases, talking, for example, about people who were the reason for spreading chaos, and of course. And so here, when we hear such expressions, what we understand is that COVID-19 cases are the reason for spreading the infection and the disease, and they are the reason for the spread of fear and chaos and panic at the country, which gives an impression that COVID patients are a cause of such problems, and that they are described as less human than others. And what does this show? This shows that there is a lack of effort on the part of journalists in selecting their terminology, their expressions, and thinking of what impact these expressions might have at the level of stigmatization of people who were infected by COVID-19 or their families and their families. So I asked a journalist in Al Maghreb newspaper, I asked journalists if who covered COVID events, if they had any idea about the manual they conducted, or they had any, of course, meetings, any discussions about what terminology to use, what words to use, and none of them had any answer. None of them actually had an idea about that these points were discussed. So there is a lack of knowledge, there is lack of access to these manuals and guidelines that clarify rules to be followed during times of crisis, because it's in these times of crisis that we need strategies, that we need rules to clarify how to cover the crisis. And also, sometimes there were information that were published without verification, and they sometimes had to publish apologies, and this is something that should be avoided during the times of crisis. So there's lack of knowledge and awareness of exception procedures during the times of crisis, and so here there's lack of knowledge that of the role of media as a bridge between, of course, specialists and doctors or officials of the topic and regular people or laymen, and to explain this phenomenon to them. Second, as the strategies used in this research and this study, and this is the second point that on which we have focused in this study, which is the media strategies used by the websites that from which we have taken the samples. So here we have seen that amongst the strategies or policies, we had spreading facts and countering rumors and misinformation, inclusion of social actors, also sharing different voices, sharing stories, and connecting with different initiatives to counter stigmatization and enhance content on, of course, practices to prevent from the virus. All of these are strategies to help counter, of course, stigmatization. We have noticed that the main focus was on the strategy of publishing facts, avoiding rumors. And here this is related to some stories about, for instance, the refusal to bury COVID victims or people who died of COVID, and such stories about lack of cure, lack of spots at hospitals, and so on and so forth. So whenever we had similar stories, officials were invited to clarify, to give correct information. Also, we noticed that these different websites, of course, they did not pay enough effort in order to investigate more facts about the virus, to share it with the public. So what they did mostly is to share statistics as they are from the Ministry of Health without more effort to clarify, to interpret. Also, as we have seen in the second, of course, level, we've seen enhancing the content on the basic practices to prevent the spread of the virus, but still that did not exceed the 1/4 of the articles, this the exception of Al Maghreb newspaper. Also, there is focus on individual responsibilities and the role of women play in preventing the spread of the disease, which increases stigmatization. Also, there is a focus on the social and psychological aspects in dealing with COVID-19, such as we said, inclusion of social actors and the influencers and showing the voices and the stories of COVID patients. There wasn't enough effort on the level of these strategies. Now, as we have seen, is that in all of the websites or from which we have taken our samples, we noticed that out of all these, ونقطة المغرب website, as you can see, made more effort to actually use these strategies in covering the crisis and trying to counter stigmatization, and that fits with the rights and awareness raising approach of Al-Maghrib newspaper. Compared to, of course, other newspapers.
So we have noticed in the outcome of this research something very important for Wataniya TV, that there is an absence of social intervention for the website of Wataniya TV. We noticed that the website of Wataniya TV does not receive the information from Wataniya TV itself, but rather receives from the Tunis agency for news. So this was a very surprising finding. And during the pandemic, we have seen that national TV Wataniya has received the biggest number of views because it is known for its credibility. In the coronavirus pandemic, things were or news have been in real time, and people have been going to the website to look into the news and all of instantaneous news. And as I said, the missing link between the website and the TV channel is very intriguing, and therefore there needs to be a policy about that, and the national TV needs to understand that the citizens should get timely news and timely information, whether on the website or the TV channel. So in terms of the pandemic itself, and the consequences and the impacts, it was rather superficial. And at the end of this research, we can say that the head of the ethical the head of the ethical journalism networks, Eden White, said that journalism can reflect the values within a society, and that the journalists and the publishers are carrying the burden of conveying that information to the citizens. So through our quantitative and qualitative analysis for the sample articles and our interviews with the journalists who covered the stigmatization with in the era of the pandemic, they didn't have a lot of evidence that should be directed linguistically and behavior-wise, and also there was a lot of stigmatization, and therefore there needs to be more attention towards that stigmatization and the use of terminology that could stigmatize people. Thank you.
شكرا جزيلا للدكتورة سلوى الشرفي، وطبعا الشكر موصول لكل الباحثين الذين قدموا ورقات مفيدة ومهمة، خاصة في الجلسة الثانية التي تابعتها والمتعلقة كل هذه الورقات المتعلقة بالوصم الاجتماعي لمرضى
the stigmatization issue in the so we start by
على أساس الجنس أو العرق أو الانتماء الجهوي أو اللون.
Discrimination based on gender, race, color, and also I would add to that age. And this point has not been raised in the Arab countries, as far as I know. So stereotypes against the elderly, they are increasing, and this gives a lot of challenges, because this kind of issue is not discussed in the public space or in the civil society circles, etc. So if things were, or if discrimination was about a gender, race, or color, then the media would take a look at it. But when it comes to the elderly, as we said, it is not being the focus of media or the public opinion. So COVID-19 has reiterated this stereotypes about the elderly, and we will also look at the scientific research in this regard. And one of the things that led us to look into this topic is the limited number on this in the Arab world compared to the Western world, where they have spoken a lot about the elderly and COVID-19. So this percentage of the population of the elderly is 20% out of the Tunisian population, and it has been defined within the constitution. So the stereotypes is the image in our minds, as Walter Lippmann says. So it's something that allows us to live more easily with our reality, and therefore these stereotypes are created to help us understand what is around us. In terms of age-based discrimination, the WHO in its 2021 report defines it as how we think and our feeling and our biased behavior towards others or towards ourselves based on age. This report categorizes Tunisia as one of the countries where this phenomenon is widespread. So the perception of the elderly in Western research is a negative perception. They are regarded as a weak class or a weak category who conduct secondary or marginal roles with, and that the old people are a burden, a social and economic burden. However, some of the other reports show the exact opposite, meaning that the old people, they have their place in the society and they have an added value to the society. So when it comes to the COVID-19 pandemic, in the few first weeks, the scientists found a link between COVID-19 infections and age. So the older the person is, the lethality is more due to COVID-19. Such discourses have been circulated on traditional media and on social media. They all categorized the elderly as one group, as a uniform group, which is not true. And this, of course, when the media spoke about the elderly being more prone to the infection, this meant that young people thought they were immune to the disease, and this also led to the idea that the old people are the ones who are spreading the disease. So the problematic of this search is to what extent do the stereotypes, negative stereotypes of old people are included in the national TV news. So especially, as we said, within the COVID-19 context, at first, old people were linked to the spread of COVID-19 and to the high number of deaths. And afterwards, as we all know, there have been other parameters that have been added to the equation. So during when it comes to the role of the elderly in the news reports, were they presented as a weak category? Are they portrayed as a category that can be locked down or confined easily? Are these positive or negative narratives? Are they harmful, or do the media contents do the contents convey the reality or not? So in our methodology, we use content analysis. As we know, this will allow us to understand communication content in a neutral manner. As for the sample, it was the news for March and April 2020 on national TV Wataniya. And this is what we called the first wave of COVID-19 in Tunisia. This first wave came in parallel with the first studies on the virus, and which shows Wataniya TV specifically, because those who do not look at the website, they are waiting for the news on Wataniya TV. During that time, people were looking for information on Wataniya TV and to confirm the cases in Tunisia. And this is actually the public institution that has duties towards the citizens. The public outlets, they need to be, they are careful about stereotypes usually. First of all, we watched all of the news from the 1st of March until the 30th of April 2021. We extracted the news and the contents that refer to older people through the use of old people, through pensioners, through grandfathers, etc. The different terminology relating to the elderly. And we did not delve into other contents that old people speak in an interview. As for the findings, we looked into 4 aspects. First, the presence of content on elderly in Watania TV news. We found that most news did not deal with this topic, and only 23 out of 61 pointed the relation to the elderly. As for the nature of the content presence for the elderly, we found 32 times where terminology related to the elderly has been mentioned. And they spoke about, for example, the old people are a part of the categories that can be infected more than the other categories of the people. As for the roles that the elderly have been called, they have always been called as people who are sick, who have COVID-19, or those who have chronic diseases. In some of the other contents, they say that the elderly are citizens. So this is one of the neutral points of view. Then we have the retired people. So this is the third role. And then we have grandfather, grandmother. Those are other terms that have been used during the news. So in general terms, the traditional roles for the elderly are minimized as the grandfather, grandmother who will tell stories to their grandchildren, or it's about the image of the retired person who is looking only to get their pensions, or maybe the elderly who are sick and need care and help. So at the end of the day, the image of old people who are doing well and who are taking care of other people is not present in the news. So as for the classification, the elderly have always been classified as a vulnerable and weak category in the news. One of the respondents in or the interviewees said on the news, if my neighbor or my father or my grandparents have COVID-19 and they need care, health care, then it doesn't matter. They do not matter because we can make that sacrifice and we save the young people instead. So this is one of the alarming statements we heard on the news. Also the other aspects related to the elderly is that it's a category that needs to stay at home, that they are not able to use social media, that they need care, and that they are discriminated against. This is the least thing discriminated against. One of the sociology experts spoke about this in the news in one of the episodes, and he said that the elderly are always discriminated against and are always called names and called as they are useless in the society. As for the sources, the main source would be an official source. For example, a minister or someone, an official from a ministry. For example, one time an official in the transportation ministry said that the elderly have been taken public transportation and this was during the lockdown, so they needn't go out. In general, most of the contents are negative. And when it comes to the scientific experts, the health experts, they are talking negatively about the elderly. It's synonymous. They always say old people are synonymous with the sickness, with infection, with contagion, etc. So the doctors would say something, and then the journalist would take on that same saying and express it differently, because, as you know, the scientific source is more detailed than, let's say, the journalist's point of view and reporting. Sometimes the doctor can say the number of deaths is high is because of the high number of old people. But this could be wrong, because we put all old people in the same baskets. Some of them are healthy, they are active, and they are not a risk. But unfortunately, this is the stereotype that that is widespread about the elderly. Some of the simple news. Sorry, she's speaking too fast.
Yeah, Arwa, Arwa, لو سمحت. Arwa, do you hear me? Can you slow down a bit?
When it comes to the discourse, we find that the titles in Spain, for example, they say that the old people are weak, they have been stigmatized, and this led to the exasperation of expressions towards the old people. And concerning the limits of this research, it only looked at the news of 8 p.m. We can expand the study to look at other news at other times, and this could be expanded to more media outlets, whether public or private, whether audiovisual or electronic and digital. This research only looks at the announced and the explicit images about the elderly. Also, the other researchers can represent some journalists, and sometimes journalists themselves, they are older journalists, and therefore they would give another perspective on the matter. So as a conclusion, this research monitors the stereotypes regarding old people. And this is the first research of this kind. The research found that old people are represented as a homogeneous and weak category, and they are only given traditional roles. These findings intersect with the findings of other studies within the same context. Thank you.